name is Dr. Maria Corona, and I am a neuropsychologist. I'm here with UCI Minds Cast's next Truth or Myth episode. Truth or myth? Is Alzheimer's disease a part of normal aging? If you guess myth, you are correct. Alzheimer's is not a normal part of aging. However, it is a fact that age is the most prevalent risk factor. The majority of people with Alzheimer's are over 65, and the risk of developing Alzheimer's unfortunately increases with age. As a neuropsychologist at the UCI Mind, my job is to assess older individuals with cognitive concerns to help distinguish between the benign changes of normal aging to the more pervasive changes associated with cognitive disorders of a progressive nature, such as Alzheimer's disease. It is also true that our brains age with the passage of time, just like the rest of our bodies, and therefore we experience changes in our mental and physical abilities. Just as our strength and stamina declines with age, our mental abilities naturally decline. It's natural to feel concerned about the changes in our mental abilities as we grow older. In normal aging, we can expect individuals to complain of such difficulties like occasionally forgetting details of conversations and events, as well as appointments or things you had to do, occasionally having mild difficulties finding the right word to say and remembering the names of acquaintances. We also know that as people age, it becomes more difficult to maintain focus and to concentrate, meaning it is easier to get distracted. However, in normal aging, these difficulties are mild and for the most part go unnoticed by others around us, and they do not affect our ability to follow our routines and to take care of ourselves. For those individuals who do go on to develop a dementia such as an Alzheimer's disease-related dementia, the memory loss will gradually worsen to the point where the impairment is so significant and so pervasive that they are no longer able to take care of themselves and they require significant assistance from others. For example, these individuals may begin to struggle to manage their finances and their medications, meaning they might miss a dosage of medications or might miss to pay a bill and manage their accounts. It can be difficult for a person to differentiate if the symptoms they are experiencing are due to normal aging versus a neurodegenerative disorder. We always encourage people to speak to their medical providers and determine if a neuropsychological evaluation would be helpful in determining the cause of their symptoms. Some degree of forgetting is typical for everyone, and there are strategies that can reduce the frequency and impact of these difficulties. For example, engaging in compensatory strategies can be immensely helpful, even for individuals with normal to above normal cognitive functioning. And for example, you can use organizational memory aids, including having routine places in your home for frequently used items such as your keys, glasses, bills, to avoid misplacing them. Using a daily planner, using strategically placed notes such as on your fridge or a whiteboard, setting alarms that can assist in remembering important information. You can also write notes or questions before you go on important meetings or appointments, such as doctor's appointments, and ask for printed copies of your appointment results or the recommendations. These will be very helpful so that you don't have to remember the information and you can always look back to follow instructions accurately. Other strategies that can help with learning and memory include things like repetition of information you want to learn and using cues to help you remember the information. Also, self-talk while performing a task, such as saying, I am taking my morning medication or I am locking the door, can be helpful for you to remember that you did those things. Also, writing things down and making lists is always helpful, such as making associations to make the information meaningful to you. It's also great. Another strategy is visualizing the information you want to learn. For example, visualizing a person while saying their name will help you with names. Visualizing the aisles in a supermarket while going over a shopping list. There are many more strategies out there, and you can always make up your own based on what you know will work for you. Other things that are also really good for your brain and will help you in preserving and even improving your memory and overall thinking include things like engaging in regular exercise, something that gets your heart pumping, such as a brisk walk, jogging, swimming, bicycling, dancing, getting a good night's sleep. It's very important, as well as reducing tension and stress by maybe using relaxation techniques or just engaging in enjoyable activities. Eating a healthy diet, one that is rich in antioxidants especially, and reducing or eliminating substances such as alcohol. Finally, increasing socialization is very important to our brains and just our overall well-being. And well, I hope this information is helpful, and thank you for listening.